Mohammad Arslan and I am from group 15B. Today I am explaining the topic Hirsutism. Hirsutism is the presence of excess terminal hair on the body of female in a male distribution. Example pattern of terminal hair distribution, that is androgen dependent, beard and mustache region, chest and tips of shoulder. Etiology of hirsutism. Hirsutism may be caused by polycystic ovary syndrome. This condition, which often begins with puberty, causes an imbalance of sex hormones. Over years, polycystic ovary syndrome slowly results in excess hair growth, irregular. The clinical features and symptoms include hair balding, face acne, and increased muscle mass and decreased breast size and enlargement of the clitoris and shift dark body hair on the face, chest, lower abdominal, inner thing of the back.
Investigations were required only if there is any history of rapid weight gain, menstruation irregularity, and viralization of early onset with rapid progress. Other tests can be done such as gynecological evaluation, including pelvic ultrasonography and ovarian size.
We need to treat underlying disorder. Cosmetic procedure produce like bleaching, waxing, and thermolysis help in improving cosmetic appearance.
This is Salman Khurshid. In dermatology, today we will discuss about cutaneous tuberculosis. Now we will discuss what is cutaneous tuberculosis. Cutaneous tuberculosis, it is a type of extrapulmonary infection. We can say it is an infection of skin which is caused by Mycobacterium tuberculosis. It is different from pulmonary TB. Now we discuss about the classification of cutaneous tuberculosis. By the help of classification, we can easily recognize the symptoms of cutaneous tuberculosis. It is divided into three main categories. First is exogenous tuberculosis, second is endogenous, and third is tuberculosis. In exogenous cutaneous tuberculosis, we can say it is the source of infection is come from outside from the body. Like any sputum is laid down on the ground and they can contact with any individual and cause TB. In this condition, the individual is naive, means individual did not have any past history of TB. This type of TB we can say the chancre TB. In this condition, the TB is immune to TB. So this condition is called the TBBC or tuberculous varicose cutis. Another is endogenous TB. In the endogenous TB, the source of infection is already present in the body, or we can say that some source of infection or some form of Mycobacterium tuberculosis is present in the body. Now we discuss how they come outside the skin. It is come into the skin by the help of three routes. First is contagious route. In the contagious route, we can say it comes by the lymph node breakout, and another is bone TB breakout, and second is hematogenous route. In hematogenous route, it is transmitted by blood, and another is auto-inoculation. In auto-inoculation means we can say the patient already have the TB, pulmonary TB. When they split out the sputum, they can affect our oral mucosa. And second, if the patient have GI TB, when the patient is vomiting, then they affect our oral mucosa. And second is if the patient also have GI TB, when they pass out the stool, then they cause or affect the rectal areas. And another is
Cutaneous tuberculosis pathogenesis. It depends on three factors, that is immunity of the host, route of entry, bacterial load. Immunity of the host depends on two categories, that is specific immunity of the host and general immunity of the host. Specific immunity depends on the exposure of the bacteria, whether it is primary or secondary, and general immunity of the host depends on the spread, that is nutritional spread, immunosuppression, etc. Now route of entry consists of three ways, that is it might be hematogenous, contiguous, or exogenous spread.
Clinical feature and symptoms. Clinical feature: febrile, painful, and erythromatous to yellowish, pulverous, and nodules. And clinical symptoms: lungs, lupus vulgaris, and tuberculosis tuberculosa, cutie, and tuberculitis.
Investigations of cutaneous tuberculosis. To confirm diagnosis of tuberculosis, first we use biopsy, which is casseting granuloma, which is pathognomonic of tuberculosis, though there might be differences between the morphological variants. Isolation of the tuberculosis, which is acid-fast bacilli and pus and culture of Mycobacterium tuberculosis. It may be possible, but only from the skin lesions, which is less than 10% of probability. Then usefulness of PCR, which is polymerase chain reaction. We can identify the Mycobacterium tuberculosis from skin. That is also very highly doubtful. Then we can also rule out pulmonary tuberculosis through X-ray.
Continue treatment of cutaneous tuberculosis. It is at two phases. First is intensive phase, second is a maintenance phase. Intensive phase is durations 8 weeks and given to patient drugs isoniazid. Isoniazid daily dose give to patient 5 milligram per kg. Second is the rimpamycin. Rimpamycin is 10 milligram per kg weight. And third is ethambutol is 15 milligram per kg. And fourth is pyranemides 30 milligram per kg gives. And second is maintenance phase. Maintenance phase is 16 weeks. 16 weeks is a drug including first is isoniazid given 5 milligram per kg, and second is rimpamycin is given to 10 milligram per kg. Okay, finish.